I can't put on weight now, and
So
I don't know what it's done to my metabolism.
Are we trading long-term health for short-term weight loss? Ozempic has been labeled a miracle drug, promising significant weight loss results. But beneath the surface lies a series of questions. How safe is it? What happens when you stop? And is it really the right solution for everyone?
You know, the popularity of these types of drugs has really eclipsed our knowledge of actually how safe they should be over time. They're expensive. They need to be injected once a month. And when people stop using these drugs, they tend to gain most of their weight actually right back.
In this video, we'll break down the facts, from how Ozempic works to its most common and severe side effects, and explore natural alternatives that may be safer and just as effective. We'll also hear insights from Dr. William Li, a renowned physician and scientist known for his research on the body's natural health defense systems. His perspective sheds light on whether Ozempic is worth the risk, or if we should look to natural solutions instead. Enough talk, let's get into it. What is Ozempic? Ozempic, known generically as semaglutide, was originally developed to help manage type 2 diabetes. It's a GLP-1 receptor agonist, a type of drug that mimics the hormone GLP-1, which is naturally produced in your gut. This hormone helps regulate blood sugar, slows digestion, and reduces appetite. By controlling these mechanisms, Ozempic helps patients lose weight while improving blood sugar levels. How does it work for weight loss? When you take Ozempic, it essentially tells your brain that you're full and slows the rate at which your stomach empties. This leads to a significant reduction in calorie intake, which can result in weight loss. For many, it's been a life-changing option, especially for those who struggle with obesity. But is this solution too good to be true? Side effects. Like any medication, Ozempic comes with its share of side effects. In his interview with Sarah Ann Macklin on her Live Well, Be Well podcast, Dr. William Li shared his insights on Ozempic. Here's what he had to say about the drug and its impact on health.
So not only are you talking about gastrointestinal distress, one of the things that can happen is it can slow your stomach motility down. So your stomach is not digesting and pushing food down the chute the way it should. And so that can cause vomiting. It can cause, premature fullness. Like, it can be very uncomfortable. Secondly, you can lose body fat in places that you don't want to lose. There's something called Ozempic face, where you start losing your cheeks. Okay, now it's bad enough if you lose fat on both cheeks, but if you only lose it on one side, because it's lumpy bumping, you start becoming asymmetric. Like, one side goes in and it starts to lack fat. That's not good. Now, one of the things that's not talked about is that as you lose body fat, so too do you lose muscle mass. So, look, and there's many more things. There's also an increased risk of some forms of cancer.
Most users report mild issues such as nausea, diarrhea, constipation, or bloating. Symptoms that may diminish over time but can still be uncomfortable. Beyond the common issues, there are more serious risks. Ozempic has been linked to pancreatitis, gallstones, and even thyroid tumors in animal studies. Additionally, some people report significant muscle loss alongside fat loss, which can have long-term health consequences. Here's where it gets concerning. When you stop taking Ozempic, many users experience a rapid rebound in appetite and weight gain. Since the medication doesn't address the root causes of weight issues, its effects are often temporary unless paired with significant lifestyle changes. Some studies even suggest that stopping Ozempic could leave your metabolism worse off than before.
We have a hardwired program inside us that goes through 4 phases of metabolism. If you want to be all you can be, work on some of the body fat, work on the metabolism. You can eat foods like tomatoes and strawberries and green tea, and there's 150 other foods, including seafood. I think we should all try to aim at getting back to our baseline metabolism so we can be who our body wants us to be from a metabolic perspective. And part of that is by fighting extra body fat. We can do this with exercise, and you need to stay active, but we can also do that by eating food. This is really about a lifestyle and trying to embrace and enjoy your life as well.
Ozempic can be a life-changing medication for those with type 2 diabetes or severe obesity, but it's not for everyone. The potential risks and the likelihood of weight regain after stopping make it a less ideal solution for casual weight loss seekers. Why risk your health for a quick fix when there are natural ways to manage weight effectively? What are your thoughts on Ozempic? Would you try it? Or do the risks outweigh the benefits? Let us know in the comments below. And if you're looking for natural ways to lose weight without medication, check out our next video where we explore the best foods and habits to help you achieve your weight loss goals. Don't forget to like, subscribe, and hit the bell icon for more health insights.